So while I'm waiting to get this sorted out, where this chest pain's coming from, I have at this point a stress test scheduled in nearly 2 weeks. I'm going to try and just maintain, do some exercise, try and keep my exertion level below a perceived exertion level of 7. But also, when I've done a treadmill before, it can be pretty uncomfortable just getting your body moving at those speeds if you're not used to running on an incline. And the point of the test is to get through it pretty quickly to determine if you have changes in your electrocardiogram, your blood pressure, symptoms, and other factors. So in this test today, this exercise session, I'm going to keep it kind of low, try and get my heart rate up to maybe 70% and about the 120 range. If I develop symptoms, so just stop at that point and rest and see if I recover. So on that brief treadmill protocol, I got my heart rate up to 120, kept it going for about 30 seconds or so, but I was at a level 14 and the speed of 3.5, having to jog a little bit. Before doing a treadmill, you want to make sure you're wearing comfortable clothes. For men, you probably won't have a shirt on because of all the leads, and women probably just a bra and maybe a light covering. But mostly, it's quite an uncomfortable test. So if you want to wear shoes that are most comfortable for you if you do have to run a little bit or jog a bit. Move your hips quickly. Again, it's a test that you hope to get through quickly with no abnormalities being shown on the cardiogram, blood pressure, or other symptoms. Like in my case, I'm waiting nearly 2 weeks to get this test to demonstrate whether this chest pain I'm having is from my heart or some unknown reason. So there's things I want to avoid. Doing a lot of exercise with my upper body, first of all, that puts an extra or harder strain on your heart as opposed to core exercise or even some lower body exercise. You want to avoid lifting heavy weights, but you can do light exercise and again to that perceived level, maybe 5 or 6, probably no higher. You want to continue on your regular medications. However, I would avoid sildenafil or any other erectile dysfunction medication, because if you were to have an event, that can interfere with treatments like nitroglycerin, which can give you a prolonged low blood pressure, which can be quite dangerous. So until you've been cleared, you want to avoid those. So for the remainder of this workout, which really doesn't fit the criteria for bone muscle, more just a general sort of light exercise session, just going to do some mobility exercises. I did want to add that the stress test and the symptoms for cardiac chest pain are more accurate for people who have pre-existing conditions that might lead them to higher risk factors like high cholesterol level, diabetes, age, history of smoking. So it's less accurate for younger folks, people with no pre-existing conditions, or the pain isn't quite sort of typical. Now suppose I come up with a positive stress test. The standard of care, in my opinion, would be to follow that with a cardiac catheterization as soon as possible, hopefully immediately, to see if they can identify if I have a very severe narrowing of a coronary artery, see if they can place a stent, or if I have to undergo bypass surgery. In modern medicine, I'm not quite sure what will happen if I have a positive test, whether they'll send me home on a medical treatment like a baby aspirin or something else. But again, the first symptom for a heart attack in most people is sudden death. They don't have the luxury of having some preceding chest pain or other symptoms leading up to it. The risk, even if it's a distal artery, far away from the main arteries of the heart, if it gets blocked, it can cause damage to the heart muscle, cause arrhythmias, which can be fatal. So, just hoping to get through this, and I hope to get back to doing full burn muscle in a couple of weeks. If you watched my last video, you saw that I was experiencing some chest pain, sometimes with exertion, sometimes at rest. It's in the center of my chest, kind of a pressure, discomfort, not associated with like radiation into my arms or other symptoms of angina, but it can be a disturbing symptom to have, particularly as a senior at 70 years old, with some issues with cholesterol and coronary artery calcification. So I'm awaiting a stress test later this week. So I've cut down on my exercise, not doing as many chest exercises, high resistance, practicing a little bit on the treadmill, trying to get my heart rate up to 70% predicted maximal heart rate, but also stopping if I have any symptoms. In my training, if a person came into a clinic with chest pain, couldn't exclude another cause, non-cardiac chest pain, we'd usually put them on a treadmill right away, same day. Seems in modern medicine, maybe it's not that standard anymore. So I'm waiting nearly 2 weeks to get a stress test, which is the best test at this point to determine if this chest discomfort could be to a narrowing cardiac artery, coronary artery that is, or some other heart dysfunction. Other things, get a chest x-ray, make sure I don't have like an aortic dissection, some other issue like that. Again, it's not 100% perfect, but the higher risk factors you have, the older age you have, the stress test is a pretty good test. If it's positive, probably follow it up with a coronary artery angiography and figuring out if there's a blockage or near blockage. So for the rest of this week, I'm again taking it kind of easy, although I am starting to do a bit more exercise with my chest muscles. Again, trying to determine if that's just basically a muscle strain, overuse, tendonitis, some other injury like that. Trying to avoid pushing myself really hard. I'll have to wait for the stress test to do that. So I hope to post a video next week, having had a normal exercise stress test, getting back to Silver Sneakers Boom Muscle. In the meantime, enjoy your workouts, take your health seriously, and try and get in as good a health as you can, no matter your age.